Good evening, everyone. So, I want to tell you a little bit of a story. You see, I keep saying it, and I will say it again. You see, this concept of calling the doctor, asking what test should you run in order to get treatment without coming to see the doctor is the most ignorant thing anybody can do. Or going to do a test, bringing it to the doctor and asking doctor, please treat me for this. That is unbelievable. So, it happens that someone called me, hey doctor, I'm having discharge for so years now. Please, it comes and goes. Which test should I do so that I can be treated? And I said, no. Please, go to the hospital and see a doctor. Okay? Let him take a history. Let him examine you and determine what kind of test you should do if there's a need for it. Yes, let me say it here. I understand that many people are running away from the hospital because of the bills. Alright? Okay. Given that the country is hard, I understand that. However, you shouldn't, because the country is hard, and kill yourself. Don't do that. Okay? So it happens that this girl now decided to see the doctor. And lo and behold, in the mind of the doctor, he was thinking that this girl probably had a sexually transmitted infection. But this girl, he now found while taking the history that this girl has never had sexual contact in any form, whether penetration or maybe by play, and someone released semen close to her private part. She has never had any form of sexual contact. So it is almost impossible for her to have a sexually transmitted infection. It was during the examination of this lady that it was found that she has features of appendicitis. So all the maneuvers, all the signs, the SOAS sign, the Robson signs were done, and they were all positive for appendicitis. Then the doctor probed further and asked, are you sure you have not had sex before? I said, no. Have you ever been told you have appendicitis? He said, yes, that she was told 2 years ago, but somebody said it was not ripe. I said, what? It's not ripe? Okay, do you feel this pain constantly? He says, the pain comes and goes. Do you have constipation sometimes and watery stool sometimes? He said, yes, it happens. Do you have fever sometimes, low grade? She said, yes. Then the doctor now went ahead to ask the nature of this discharge. And it was found that this discharge was very, very foul smelling, and it was yellowish, and it was not in the shape of an original, a typical vaginal discharge. And this doctor now ordered for some radiological investigations. and it was found that this girl had what they call a fistula, what they call appendicovaginal fistula. The appendix has fused with the vagina, and the content of this appendix is now leaking out into the vagina, which is a rare condition which some persons will never find in their medical practice. You see? If not that this doctor insisted that this lady should come for proper history-taking examination, she could go on and be treating sexually transmitted infection that she doesn't have when she has not even had any sexual contact. So, what am I saying in essence? What I'm saying is, when you have symptoms like this, don't go about taking drugs, okay? Come to the doctor for proper evaluation. Life has no duplicate. Thank you.